Have you heard of the coital alignment technique? I'm Dr. Meena Malik, urologist and pelvic surgeon, and today I'm going to talk all about this technique that is designed to enhance female orgasms during penetrative sex. Now, you may have heard about it on the first season of Sex Life where they talk about it, and it's probably the first time I've seen it talked about in the popular media. But essentially, in this technique, the man lies on top of the woman, but he doesn't rest on his elbows. This allows him to be more comfortable because he's not putting a lot of pressure on his upper body. Now, instead of the normal position when you're on top, the man sort of shifts a little bit on top of the woman so that the base of the penis directly touches the clitoris. And then they engage in sort of a rocking motion. So the woman is moving upward with her pelvis and the man is moving downward with his pelvis. And it's sort of like a dance. It has to kind of move together for it to work and keep this rocking motion together. Now, let's talk about the science behind this technique. It was actually introduced in 1988 in a study by Eichel and Kuhl. And in this study, they introduced the CAT. They had 22 women who were trained to use this coital alignment technique, or CAT, and 22 that were untrained. These were sort of tried to be matched demographically, so they were the same age, same race, that sort of stuff. And in the experimental group, again, of these 22 women, they did find that they were more likely to have orgasms, complete their orgasm, and often had more simultaneous orgasms compared to those who didn't get trained. Then in 1992, Helen Singer Kaplan, who is a renowned sex therapist, completed another study where herself and several of her colleagues tried to use the coital alignment technique. Now, they only tried to do it 1, 2, or 3 times over the course of a 2-week period. Now, they didn't actually report the same types of findings. They actually reported that it was sort of difficult to climax with the technique, and they ultimately resorted to doing more familiar ways or more familiar techniques to actually achieve orgasm. And I think really they were concerned that were they satisfying their partners? Could they really commit to the technique? And I think that this really boils down to that this takes a little bit of practice and a little bit of buy-in from both partners. In 1995, they then conducted another study where they tried to compare women who were trained in this technique by sex therapists to those who underwent directed masturbation training. And this is sort of a standard treatment for sex therapists to incorporate in people who are having issues with sex in their relationships. So in this format, they underwent sort of an 8-week sexual enrichment workshop. And then in this 8 weeks, the first 4 weeks was sort of learning how to assert yourself, what are the differences in genders in terms of pleasure and arousal, their preferences, some specific exercises, and communication skills. Then in the second 4 weeks, they learned their respective technique, either the coital alignment technique or directed masturbation. Now, what they found was that there was a 56% increase in orgasms during sexual intercourse in the group that had the coital alignment technique workshop, compared to 27% increase in those who did directed masturbation. Also, those women in the coital alignment technique, or CAT group, were more likely to be moderately or substantially orgasmic during intercourse. Now, the last study I'm going to share looked at 2 matched groups of women, meaning again, they're matched based on age, their other issues, who all had hypoactive sexual desire. So this is not relationship issues, this is they are not interested in having sex and it's bothering them. So both groups received a standard treatment protocol that included sex therapy as well as marital therapy because they wanted to make sure they addressed any relationship issues. The experimental group then went on to receive additional training in the coital alignment technique. And generally in both groups, they had increases in desire and arousal. However, women receiving the coital alignment technique training had significantly greater changes in their arousal. And when looking at an index of sexual satisfaction, meaning a validated questionnaire, at 6 months, only the coital alignment technique group had an improvement in sexual satisfaction. Now, the interesting thing about when you're implementing this, I think there's 2 major things. One is that it takes a little practice, right? Anything new that you're trying, particularly that requires some physical movement, can require one buy-in by both partners as well as some practice to make sure you're doing it correctly. And it may not always work the very first time. The other thing is that you generally don't want to have a goal of reaching orgasm because because that can then lead to performance anxiety. In this case, having a goal to be physically intimate in a new way and to try to increase intimacy is a better goal than just achieving orgasm. And I think that's really the mindset that you need to get into if you want to try using this technique. If you like this video, make sure you check out my video on enhancing sexual pleasure. And as always, remember to take care of yourself because you're worth it.